Well, there's only one good thing Tony Abbott's done, is it's brought us all together to kick his ass. So on behalf of the Wurundjeri today, we welcome you here, and I want to let you know that not only Wurundjeri, but the whole state of Victoria, every Aboriginal person is being affected by this, and every Aboriginal person is supporting this march today for the rights for health services. Thank you.
Now I'm here today to say the union movement is 100% opposed to this disgusting budget of Tony Abbott. You know what we support? We support free healthcare for all Australians. Now, we're all here gathered together and we've got the whole heap of media here. I think they need to hear our voices a bit. So I'm going to ask you a few questions and I want you to respond. Do you support Tony Abbott's $7 GP tax? No! Do you support Tony Abbott's $5 medicines tax? No! Do you support Tony Abbott's $80 billion worth of cuts to healthcare and education? No! I didn't think you did. I reckon Tony Abbott is banking on all of you people and all of Australians forgetting about these cuts. Are you guys going to forget? No! Are you guys going to let him get away with it?
No! Imagine for a moment a 75-year-old woman, could be you, could be your mother, could be your grandmother, a full pension, $20,000 a year. She has a few illnesses common at that age: diabetes, high cholesterol, blood pressure, osteoporosis. What will these budget changes mean for her? She'll pay $70 extra for her GP visits every year, $80 extra for her pills every year, $150 a year. That is 0.75% of her yearly income. 0.75%. Permanent. A permanent tax on illness. What we are moving towards is an American-style system where the rich hardly notice the change. Where the brunt of the battle falls on the low-income Australian.
As paramedics, we're currently fighting with the Abbott Government through our industrial action to try and improve some of the serious problems with ambulance response times and with hospital ramping. Under this Victorian Government, the Victorian public are waiting longer than ever before for an ambulance when they are critically ill or terribly injured. We can't keep this going. Something has to change. This payment is unnecessary, unwanted, and going to put an immense amount of stress on an already overstretched healthcare system and a crumbling ambulance service. Everyone should have access to free healthcare, and no one should feel like they can't afford to go to the doctor.
The Victorian Aboriginal community has 50,000 years of history, and much of the last 200 hasn't been that great. We oppose the Medicare co-payment because it's bad public health. It is bad health policy for all Australians. The $7 is real money. I'm worried that a treasurer doesn't understand that. This is not small change we are talking about. $7 shouldn't be the difference. And I repeat, $7 should not be the difference between my getting a doctor's appointment, a doctor's visit or not. It shouldn't be the difference between a flu vaccine or not for any elder. It shouldn't be the difference between early detection of cancer or not for anyone. And international evidence shows that the best health outcomes are achieved most cost effectively through universal, comprehensive primary health care.
Unions fought for Medicare, they fought for the creation of it, and they fought for the recreation of it under the Hawke government. It was a trade-off for workers' wages. It is a taxpayer-funded system. It is not free. We pay for it through our taxes, and we do it. We do it with pride, and we do it with pleasure, and we do it gladly.
This rally is happening today not just because you reject this government's plan to slash Medicare. We are in a battle for the soul of this country. Right now, on the 1st of July, Janet Rice is going to join me in the Senate and the Greens will block these changes. We're here today not just because we want to protect Medicare, not just because we want to stop these changes, but because we want to build it up. We want to expand Medicare. We want to bring dental care into Medicare.
What we're seeing here isn't new. Back in 2003, Tony Abbott's mentor, John Howard, tried to rip $2.5 billion from Medicare. He attacked it just like Abbott's attacking it today, and we stopped him. At the time, in 2003, who was Health Minister? Anyone remember? Tony Abbott. Tony Abbott was Health Minister. It is the same agenda we saw 11 years ago.
No cuts, no fees, all Aussies need GPs. No cuts, no fees, all Aussies need GPs.